14, depressor muscle of the angle of the mouth. And I will accept that, you know, English. However, if you translate it into Latin, how do you say that in Latin? Depressor angularis oris. So on a test, you can give me depressor angularis oris or depressor of the angle of the mouth. Okay? You know, it's the same thing. All right? I usually prefer the Latin, but we have it here in English, so I'm going to accept it in English, okay? But depressor of the angle of the mouth. First of all, the angle of the mouth, everybody should know that depressor is heading down, okay? But the angle of the mouth is where your upper lip meets your lower lip. Right here is the angle of the mouth. Okay, so this muscle is going to pull that angle down. Then what am I doing? Frowning. This is your frowning muscle, okay? This is your muscle that makes you frown. So you're going to go to the angle of the mouth to start and find this, okay? And then you're going to see, where do I see a muscle that's heading? Its lines, the fibers are heading down. And actually, the fibers, they don't head straight down. They go out a little bit. You see what I'm doing? They arc out a little bit. Okay, so I don't know, here, you know, we're going to do it on all three of them. Doesn't matter which one I grab first. Here's the angle of the mouth. And here's these lines heading down. Think about this muscle pulling downward. It's going to pull the lips into a frown. So here's the depressor angularis oris, okay? On this guy, where are we? Wait a minute, I have to find his lips. There they are, and come out down here. But what I'm trying to do with the stick is show you that this muscle here, as it heads down, it's pulling the angle down. See? Okay, so this muscle here. And again, the little guy might be tiny, okay? But here, go to the angle, and then here, head down. So this muscle there. Everybody see? Okay? So again, he's small, but he has everything we've gone through on the sheet. He really does. Okay, where are we? Orbicularis oris. What do you think this is, folks? Again, that word orbicularis, making an orbit, a circle around the mouth. And this goes entirely around the mouth. I think you're what, page 228? Okay, look at page 228 of your lab manual, and you can see that this muscle makes an entire circle around the lips. Our models don't show the entire circle. I think this guy comes the closest to showing the most of it. Here. Circle around the lips. Okay, this guy I think shows the most. And sometimes I joke, this is your mustache muscle. You know, where would a mustache be? Up here, okay? So, circle around the lips or around the mouth. Okay. The other models cut it off a little bit to show, you know, some other muscles, but they have some of it. I'm trying to see. Well, this has, what, this much, okay? Again, more of the mustaches, I like to joke. And the same with this guy. He has more of the mustache, but actually he comes around this way a little bit more. All right? So these, to me, these are not hard muscles. Okay, where are we up to? Depressor muscle of the lower lip. And again, I will take the name in English, but also depressor inferior labus, which means inferior lower labus lip. So either Latin name, I mean, you know, I should say I insist on the Latin name, but again, because it's on your sheet in English, I take it in English too, so whatever makes you happy. It's not bad to learn the Latin, folks. You'd be surprised how it helps you in life, okay? All right, but depressor lower lip. That means pulling down the lower lip. And what is that? I'm making faces at you, okay? I pull down my lower lip. So you're going to look for a muscle that attaches to the lower lip, like I'm putting on lip liner, okay? And pulls down. Do you follow what I'm saying? Okay? Because if you understand this, it's easier to find the muscle. Okay? I don't know. Yeah, here we are. Here's his lower lip. And here's this muscle heading down. It's attached to the lower lip and it's pulling it downward. Everybody see that?
Is it attached to the whole bottom of the lower lip?
Yes, it is. This is like, in other words, they have peeled at different levels here. Like they don't have the whole orbicularis oris here, you know, because they want to show other things. So this is under, you know what I'm saying? Okay. So here, heading downward, okay.